The coronavirus or COVID-19 was first reported in Wuhan, in China's Hubei province in December 2019. In the following months, the disease rapidly spread to more than 90 countries across the world.
Both by the alarming levels of spread and severity, and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
This medical center could barely cope. The most vulnerable were the elderly. It was not long before South Africans who had traveled to Italy fell ill on their return.
As you have heard already, honorable members, we have already confirmed the first case that has tested positive for the coronavirus or COVID-19 in South Africa, in KwaZulu-Natal. I was informed this morning, I've already briefed the President. This is a person who had traveled to Italy, and they were a group of 10, and so they returned a few days ago. But the patient had consulted a general practitioner who was, because of the level of collaboration, was aware of the protocol that we have to take. Patient had presented with fever, headaches, malaise, and sore throat, not much of a cough. And in the process, they took the specimen, and then they got the laboratory informed. And this has been tested positive.
President Cyril Ramaphosa stepped in to lead the fight against the pandemic as fear and uncertainty gripped the nation.
From the start of the outbreak in China earlier this year, the South African government has put in place measures to screen visitors entering the country, to contain its spread, and to treat those infected. As of now, South Africa has 61 confirmed cases of people infected with the virus, and this number is expected to rise in the coming days and weeks. Initially, it was people who had traveled out of the country, especially from Italy, who had positively tested for the virus. It is concerning that we are now dealing with internal transmission of the virus. This situation calls for an extraordinary response. There can be no half measures. Cabinet held a special meeting earlier today, after which, due to the serious measures we are going to announce, I've taken time to consult with our premiers and a number of other stakeholders. We've decided to take urgent and drastic measures to manage the disease, protect the people of our country, and to reduce the impact of the virus on our society and on our economy. We have now declared a national state of disaster in terms of the Disaster Management Act. This will enable us to have an integrated and coordinated disaster management mechanism that will focus on preventing and reducing the outbreak of this virus. We will also be able to set up emergency, rapid, and effective response systems to mitigate the severity of its impact. Following an extensive analysis of the progression of the disease worldwide and in South Africa, Cabinet has decided on the following measures. Firstly, to limit contact between persons who may be infected and South African citizens. We are imposing a travel ban on foreign nationals from high-risk countries such as Italy, Iran, South Korea, Spain, Germany, the United States, the United Kingdom, and China as from 18th March 2020. We have cancelled visas to visitors from those countries from today, and previously granted visas are hereby revoked. South African citizens are advised to refrain from all forms of travel to or through the European Union, the United States, United Kingdom, and other identified high-risk countries such as China, Iran, and South Korea. This is effective immediately.
As countries grappled with the pandemic, South Africa had to evacuate its citizens from the epicenter, Wuhan. The country accommodated those coming from China at the quarantine center in Limpopo. They were soon given a clean bill of health. The African Union requested President Cyril Ramaphosa to lead the fight against the pandemic and also source vaccines for Africa. A challenging task, as according to an Oxfam report from September 2020, wealthy nations representing just 13% of the world's population had already bought more than half of the promised doses of vaccines.
Within a matter of weeks, the coronavirus pandemic forced us to urgently reprioritize both our programs of action and the deployment of our resources. Our most immediate and pressing concern was to manage the impact of the pandemic on the people of our continent. We worked with urgency to develop the Africa Joint Continental Strategy for COVID-19 and have effectively implemented it through the various structures of the AU.
South Africa had to deal with its own controversies, the PPE scandal, and the resignation of the Minister of Health, Dr. Zweli Mkhize.
Following the request I have received from Minister Zweli Mkhize to allow him to step down as the Minister of Health in order to bring certainty and stability to the health portfolio. I'm grateful to Minister Mkhize for his service to our country, and particularly for the outstanding leadership he has provided in the face of the worst pandemic in over a century in our country.
The pandemic had a negative impact on the economy of the country. South Africa was still recovering from the effects of economic crisis of 2008 and the state capture shocks. Many people lost their jobs.
The action we are taking now will have lasting economic costs. But we are convinced that the cost of not acting now will be far much greater.
The end of lockdown brought some relief. The developing countries did not come to the party after making commitments to help the developing nations.
We felt like we were beggars when it came to vaccine availability, when we felt we needed access to vaccines, and the northern hemisphere countries had bought all the vaccines in the world and they were hogging them. And they didn't want to release them at the time when we needed them most. And we felt like we were begging. And at times it felt like they would just be droppings from the table, that yes, we will give you that and that. And let me tell you something that generated a lot of resentment.
South Africa is credited for being among those leading the coordinated response to the pandemic.
Post-COVID, by the way, got us to lose 2 million jobs in just an 18-month period. We've regained those jobs, and we've demonstrated that the South African economy can create jobs. And these are not just job opportunities, but jobs that were lost, and we regained some of them.
The coronavirus pandemic occurred just over 100 years after the Spanish flu of 1918 and 1919, which infected about 500 million people, or 33% of the world's population. Sophie Mokoena, SABC News, Johannesburg.